Everyone, welcome to its Healthy Mention channel. So today we are going to see a subtopic from the subject repertory, that is what are clinical repertories. In this we are going to cover what is clinical repertories, types of clinical repertories, scope and limitation of clinical repertory. So let's begin. What is clinical repertory? Clinical repertories are those repertories which contain clinical symptoms, conditions, and those corresponding group of medicines. These repertories facilitate the selection of a remedy on the basis of pathological similarity, causation, modalities, and concomitance. They are not commonly used for the purpose of repertorization. These repertories can be used for repertorization of cases where clinical conditions mask the characteristics of the patient. In such cases, the physician finds the prominent common symptoms with a few modalities and concomitants. These cases need the help of clinical repertories for selecting the simillimum. Now, types of clinical repertories. There are two types of clinical repertories. One, it is called as general clinical repertories, which covers the whole body, and second, regional clinical repertories. First, general clinical repertories example J.H. Clark Clinical Repertory, the prescriber by J.H. Clark, Oscar E. Borek Clinical Repertory. Now, regional clinical repertories examples, most famous question asked in exams are these: Bell's diarrhea, Berry's disease of the eyes, Minton uterine therapeutics, therapeutics of fever by H.C. Allen. Now let's see the scope and limitation of clinical repertories. Clinical repertories can be used in the study of homeopathic therapeutics as well as materia medica. They help to repertorize the following types of cases: cases lacking in mental generals and physical generals but rich in common symptoms, cases with clinical diagnosis, short cases with a few symptoms. Next, clinical repertories contain some rubrics which are not found in other general repertories. Therefore, they can become a good companion in the study of such rubrics. Clinical repertories help us to find the most appropriate palliative medicine in incurable cases. Now, the fifth point, they are used as quick reference books at the bedside. Regional repertories help in finding out the simillimum in a specific clinical condition. Now, limitations of clinical repertory. Clinical repertories are based on nosological terms and clinical symptoms, which are the result of clinical observation. Hence, their use is limited to particular type of cases. They are mainly used for reference work. So here we have completed the topics present in clinical repertories. Special topics, examples of clinical repertories has been explained in further video. Thank you for watching.